I will have some similar outcomes than my previous speakers, but also some different. And the topic is why my experience differs from choice closure. These are my disclosures. So we have already seen from Nicholas the choice closure study. It was a randomized study, so it's always good to have randomized data available. Randomizing 516 TAVI patients undergoing transfemoral TAVI to either a plug or a suture-based closure, so the MANTA or the ProGlide. And you have already seen the results, and I will not go into details here, but you see the main endpoint was vascular closure associated minor or major vascular complications, and this occurred in 19% in the MANTA group and in 12% in the ProGlide group, and this was statistically significant different. So as you also can see that most of these complications were minor vascular complications, and in fact the assessment of the groin was quite rigorous, and that's why we see slightly higher complication rates in this trial with both devices than we usually see in other trials. Now, also the minimal femoral artery diameter was 7.8 plus minus 1.6. That means that about a quarter or a sixth of patients actually have a minimal artery diameter of 6 millimeters or less. And we have severe calcification in 30% of patients. Now the plus is certainly this is a randomized trial. It's quite a large number of patients. There are all comers. They included a lot of patients, and these are experienced large volume centers. So I think they did a good job. And the minus is, as said before, ultrasound-guided puncture was only performed in a minority of patients, and we see predominantly minor complications, so a lot of hematomas that may not affect the short or long-term outcome of the patient. Now, I show you our experience in Luzern, and we have used the MANTA close to 500 times now. And when I use a device, I want to know, do I use it the right way? Do I use it the best way? And that's why I collect the data and then analyze the data. And so the first thing I want to show you, and we have also seen this before, is the time to hemostasis. So with the MANTA, we have almost 80% of patients with immediate hemostasis, as opposed to 34% with the ProGlide. And then within 5 minutes, we have more than 90% of patients with hemostasis, as opposed to about 80% with the ProGlide. So the rate of immediate hemostasis, and you will see this if you use the device, is much, much higher with the MANTA. Of course, we also had complications, and as said, we have almost 500 MANTA implants now. In Luzern, we also do almost 100% TF. So really, we aim for 100%. And we use the MANTA in 85% of cases, so not 100. The good thing is we have a registry which is also clinical event committee adjudicated, so these are good data. And this is our overall experience from the first MANTA to the last MANTA, and we see that we have a major vascular complication rate of 4%, a minor of 3%, and 93% have no complication. Now, what is different to the previous presentation by you, Magnus, we actually did have a learning curve. And this is our learning curve. Yeah, so when we started 2018, and you can see in the first year we had actually a few complications, and then already 2019 it was much better, and now we're consistently at the complication rate, overall complication rate of 4%, and that's exactly what we have seen before and what we have also seen in the study. So why did we have the learning curve? What happened with these patients? And now when we look at our further experience, so the first 100 patients, we had in total, you can see here 11% complication, 11 complications. With the second 100, we had 2 complications. So from 11 to 2, how did we improve? We paid more attention with our puncture. We really aimed for a puncture exactly in the middle. We did not puncture too low, we did not puncture too high, and we avoided patients with a very calcified small iliofemoral anatomy, especially the common femoral anatomy. And with that, we were able to reduce the complication rate to 2% with the next 100 patients, so a dramatic improvement. So in summary, we have to understand the MANTA closure and of course the choice closure trial, which is a great trial. Precise ultrasounded puncture is very much important. It's probably more important with the MANTA than with the ProGlides. And I would still recommend that you check the height of the puncture with fluoro. You can see the femoral head also with the ultrasound, but I still recommend to check the height, because especially if you're starting with ultrasound-guided puncture, it's actually easy to be too high with your puncture, because you want to see your needle in the ultrasound, and people are tending to puncture quite high. And then we have to keep away, as Nicolas has shown in his initial slides, from the femoral bifurcation and the inguinal ligament. So the sweet spot is sometimes quite narrow. And we probably should avoid small arteries. Yes, you can do it. Magnus, you have shown you have done all comers, it's possible, but I would still recommend, if you have a very small anatomy, like a 4 millimeter artery that is calcified, then I would not use the device. And it's very important to know the possible complication that can happen. Don't be afraid of the possible complications, because usually you can still treat the patient, but you cannot use the same wire once you have inserted the MANTA. So you have to go either ipsilateral with a new puncture, or you have to go contralateral. But overall, we are very convinced of the device. I really like the fast hemostasis, but you have to know how to use it and when to use it. Thank you very much.